We will focus our intervention in the prevention of Zika virus infections in Nicaragua. Our group is formed by Jessica Green, Christopher Gallucci, Rachel Silverberg, Liti Koshi, and Melina Taurasi. Nicaragua is located in Central America and has a population of approximately 6 million people. It is ranked as the second poorest country in Latin America and has the highest birth and fertility rates in the region. According to the latest national census, 27% of pregnant women were aged between 15 to 19 years old. Also, 48% of women would have their third child before they reach their 20 years old. Nicaragua, as well as all the countries in Central America, has confirmed cases of Zika-infected mosquitoes. Zika has been linked to very serious birth defects, such as microencephaly. Given the alarming birth rates and the risk of transmitting Zika virus to unborn fetus, it is of utmost importance to reduce the incidence of Zika virus infections in Nicaragua women aged 9 to 49 years old. Our intervention will focus on the prevention of mosquito bites, which will greatly reduce the chances of a woman contracting Zika and putting her fetus at risk. We will use the theory of plant behavior to guide our efforts and interventions, since it allows us to study behavior interventions resulting from individual ideas about attitudes, control, and normative beliefs. Taking a qualitative approach by understanding the culture, motivation, and perceptions that guides individuals will give us a better insight in how to address this issue and help tailor it to the study population.
The Zika virus has become a threat to the health of young women and their potential offspring in the country of Nicaragua. It is estimated that 844 pregnant women have become infected with the Zika virus so far. When the average number of women who become pregnant each year in Nicaragua is taken into account, 6,170 to be exact, according to data collected from the World Bank, it produces the alarming rate of more than 1 in 10 pregnant women having the Zika virus in them. The Zika virus proves to be detrimental to the health of the unborn child in that it raises the risk of the baby being born with microcephaly significantly by up to 13%. This data demonstrates the necessity of public health interventions aimed at reducing the rate of the Zika virus infection among this vulnerable population. So, because of this necessity, our proposed intervention's intent is to decrease the incidence of Zika and Zika related cases of microcephaly among Nicaraguan women and their children. We seek to raise awareness of what the Zika virus is and the risk factors that increase a woman's chance of acquiring it, as well as to promote protective behaviors that these women can employ in order to prevent them from getting the virus. Increasing awareness of what the virus is and the risks that it poses to the health of a woman and her children will allow our target population to have the information needed to understand the necessity of shielding themselves from acquiring the virus. By promoting ways to protect oneself from risk factors contributing to the chance of getting the Zika virus, we are assisting these women in gaining the knowledge and skills needed to engage in protective behaviors that will decrease the chance of them becoming infected with the virus and thus decrease the risk of their future offspring developing microcephaly. We aim to do this through several different methods that we will go more in depth later on. We basically want to create more opportunities for women to gain accurate knowledge pertaining to the Zika virus by equipping local health professionals with up-to-date knowledge and skills, and by utilizing mobile clinics that will reduce the barrier of access and time-related issues for these women. We also intend to have more of our target population engage in preventative behaviors such as screening and avoiding mosquito bites. We also intend to influence the social norms surrounding factors related to Zika, such as condom use. In creating our messages targeted at increasing Zika awareness, we will work with members from the target population in order to produce and disseminate culturally appropriate and relevant messages. By engaging them in this process, we hope to raise awareness and impact their perceptions and control beliefs in regards to preventing the development of Zika. In summary, this intervention aims to assess and influence changes in these women's attitudes, norms, and control beliefs so that ultimately there will be reductions in the incidence rate of the Zika virus and the number of Zika related cases of microcephaly. Our objective is to reduce the incidence of Zika virus infections from 14% to 7% in Nicaragua among women aged 9 to 49 by October 2018.
Our intervention will consist of 3 components: a clinical portion to educate healthcare professionals, as well as 2 parallel social marketing campaigns to promote awareness of the Zika virus and to increase engagement in protective and preventative behaviors. Because our intervention will seek to influence the constructs of the theory of planned behavior, we believe that slight differences in culture, motivation, and perception will exist between the following groups. For women between the ages of 9 and 20, we will run a citywide radio campaign with messages created in a classroom setting by female students in 3 selected high schools. We will begin this project by conducting a 1-hour educational seminar for female students at each of these 3 high schools. The seminar will focus on the Zika virus, its transmission, and the importance of environmental and self-protective measures. At the end of the seminar, we will present the students with the challenge of writing a creative radio message to inform each other about the Zika virus and to motivate engagement in protective behaviors. 1 radio message from each high school will be selected for recording and ultimately circulated in the citywide radio campaign. In this way, we hope to provide the information and resources for younger females not only to take ownership of their own healthcare, but also to influence the behavioral, normative, and control beliefs of their peers. In the context of this arm of the intervention, we will also offer free screening services for the Zika virus. For women between the ages of 21 and 49, we will run a citywide billboard campaign with messages created through focus groups with female community members. These focus groups will be conducted with the goal of understanding the perceptions of the Zika virus and intention to engage in protective behaviors among representative members of this age cohort. In this way, we hope to create evidence-based, salient messages that will motivate engagement in protective behaviors by meeting this cohort where they are. After each focus group, we will offer free screening services to participants. For the clinical portion of the intervention, we will hold training sessions about the Zika virus for healthcare professionals at local hospitals and medical offices. The rationale behind this part of the intervention is to ensure that healthcare professionals are aware of the Zika virus, as they will be an important line of defense. We need to equip them with the appropriate knowledge so that they know what to look for, how to educate their patients, as well as how to conduct screenings in order to continue the fight against Zika after our intervention is finished.
Our intervention will utilize both the formative and summative evaluation techniques. A formative evaluation will be conducted during program session all the way through the implementation phase to help ensure that our program has been conceptualized and developed appropriately. Since we have developed our own program instead of utilizing an existing one, we will provide justification and evidence as to the degree by which the program is approved by relevant stakeholders, justified by the needs assessment data, as well as the degree to which it is evidence-based. Addressing these elements early on will help orient us to make careful assessments about other program and evaluation components. Evaluating the knowledge, skills, abilities, strengths, and weaknesses of our internal and external partners, as well as using cost-benefit analysis, will allow for a proper assessment of our capacity and resources available to implement the program. Even more importantly, ensuring that the consumer orientation, or the degree to which programs are adapted and adequately address the values, wants, and needs of our priority population, will help ensure that the program is more readily accepted early on. Assessing multiplicity and the closely related concept of support ensures that the program not only has multiple components, but an adequate amount of built-in reinforcement components to assist participants with the expected level of involvement and behavior change. Inclusion will also make sure that we have included the right partners to be involved with the program with the same values and commitment level, whereas accountability will ensure that each partner organization performs its work as previously arranged. Based upon feedback from partners and participants through the collection of data and questionnaires, necessary changes to the program will be made or adjustment to achieve better adherence and outcomes. The concepts of recruitment, reach, and response relate to the program promotion and help ensure that an adequate number of people are participating and that the program is being communicated effectively via the proper channels. This will help us determine if the radio pamphlets, newspaper, and billboard campaigns are well received, engaging participants, or are not effective at all. Finally, interaction and satisfaction will help determine the level to which practitioners effectively work and communicate with participants, as well as how satisfied participants are with the program components. Understanding program effectiveness and participant satisfaction will help provide recommendations for adjustments as well as inform future applications of the program. Our intervention will utilize a summative evaluation, which are a combination of measurements that permit conclusions to be drawn about impact, outcome, or benefits of our program. Here we will determine our success in accomplishing our goals and objectives related to changes in behaviors and the incidence of Zika virus. To evaluate our impact objectives, we will conduct follow-up focus groups with individuals from each segment of our priority population, consisting of healthcare providers, women between the ages of 9 through 20, and women between the ages of 21 through 49, approximately 1 to 2 years after the program implementation. Through these focus groups, we will work to assess knowledge, attitudes, and behavior related to the Zika virus. Identifying any gaps in knowledge during this step will also inform the adjustment of future educational materials. To evaluate our outcome objectives, we will examine Zika virus and Zika-related microcephaly epidemiological data annually, using relevant data gathered during our needs assessment as a baseline for comparison.
In order for our efforts to have maximum impact, we needed to split our target population into two groups, those aged 9 to 20 years and those aged 21 to 49 years. This allowed us to target each age range based on demographics, priorities, education levels, and targeted marketing campaigns that were most likely to reach our audience. One of our overarching goals was to ensure that we were reaching the target population appropriately and in a way that would be effective and well received. Multiplicity and support were very important in our campaign, as was partnering with the right community organizations and partnerships to have the desired outcomes. Recruitment reach and response rate were also key factors to determine if we were reaching the target population with the intended outcomes. Essentially, these will help us gauge if our campaign is working. Focus groups and satisfaction surveys will help us gauge how the campaign was received and how we can improve the program for our audience in order to improve outcomes. This will also allow us to assess how knowledge, attitudes, and behavior have changed regarding the Zika virus over the course of our campaign.